Hello, everyone. Welcome to mine and Camille's presentation over drug overdose prevention for the Emotional Wellbeing Challenge at the 2023 International Leadership Conference. My name is Liana Villarreal, and I represent the University of Texas at Austin HOSA chapter as the competitions director.
And my name is Camille Cuclerita, and I represent UT as the treasurer.
We are in the post-secondary division through the Texas HOSA Chartered Association and are so excited to share our presentation with you all.
Before we get started, we would like to ask you to fill out this pre-presentation survey. All responses are anonymous, and you do not have to answer any questions you feel uncomfortable with. We just want to get some information about your current attitudes and beliefs regarding substance abuse and drug overdoses.
Camille and I are both immensely interested in how we, as future healthcare providers, can help college-age students who are experiencing drug misuse that eventually leads to drug overdoses. I currently volunteer with the Texas Harm Reduction Alliance in Austin, Texas. In an effort to help end the drug war and the inevitable harm it causes, I specialize in harm reduction outreach. Drug usage is an immensely complex issue that is best approached by eliminating the harm at various levels. We must be able to meet people where they are at with compassion and acceptance and dismiss the stigmas surrounding their usage. Many members of my family are experiencing substance use disorders, which drives my motivation to gain a deeper understanding on why people overdose on drugs. This upcoming summer, I will conduct research regarding drug taking and drug seeking behaviors at UT Health San Antonio with a pharmacology primary investigator.
And for me, as a future healthcare professional, I felt that substance abuse is a very topical issue and something that we come to deal with all the time. As a pre-dental student, I have volunteered in clinics that provide free dental care for a diverse population, including those who are recovering or who have recently recovered from addiction. And that motivated me to want to learn more about what resources are available and what I can do to help. This research was helpful in allowing us to better understand what servitude in the healthcare profession means. It helped us see that there is a person behind every disease and illness and increased our compassion and understanding for people in difficult situations like drug addiction. In addition to these abstract concepts, we improved our communication, collaboration, research, and analysis skills.
You may be wondering, what do you gain? Well, our target audience is you, our college-aged peers who are aspiring healthcare professionals. Our presentation will help you understand what actions can be taken now as a student regarding drug overdoses and misuse. You will also learn about options to consider when you are a healthcare professional. Over the past decade, drug misuse among U.S. college students has become a significant public health concern. College students may use certain drugs in an attempt to improve academic performance, reduce pain, or to induce sleep among a multitude of other personal issues. Ultimately, the rate of drug misuse among college students is only continuing to grow as the years progress. Getting educated about drug overdoses now will help prevent drug overdoses later.
Yeah, so as current college students, we understand that drugs are a prevalent issue. It affects the peers we see in our classes, we see in our student organizations every day. And the effects are not limited to overdoses, but also bleed into everyday life through academic performance, friendships, and relationships.
To provide a fuller picture, we wanted to include data regarding drug misuse in our presentation. 28.1% of college-aged adults report having misused some sort of drug at least once in their lifetime. In 2021, over 71,000 people died from drug overdoses in the United States. More than 77% of overdose deaths likely involve fentanyl. Fentanyl is often combined with some other illicit substance. Most people are not even aware that they are consuming fentanyl when they are taking the drug. Fentanyl is also 100 times stronger than morphine and 50 times stronger than heroin. Death rates for drug overdose causes are higher in urban areas than rural areas for people aged 15 to 24, and this includes college-age students and college campuses are primarily in the urban areas. In a 2018 study of people in school, the annual prevalence of drug abuse was the highest among college-age students, which is 45%.
And so right now, as young adults in college, we have the power to change people's relationship with and understanding about drugs. We are a voting age. We can vote for policies that promote solutions such as Narcan distribution. And Narcan is a nasal spray that can be easily administered to reverse an opioid overdose. We can also vote for policies about building more treatment options. Currently, the vast distances between treatment centers make them inaccessible. You can volunteer in community outreach programs and back overdose prevention sites. You can support your peers who are facing drug issues. To help those struggling, we need to clear the stigma around seeking help. Be an open and warm person who people are willing to talk to, and encourage peers to seek help when they need it. Lastly, drug issues are correlated with mental illnesses like anxiety and depression. Find people you can talk to and seek professional help for mental health needs.
People who use drugs are among the most vulnerable members of our society. How we choose to treat and care for them is a direct reflection on how we prioritize humanity. As a future healthcare provider, you can help people experiencing drug misuse in many ways. You can screen patients for substance use disorders and provide resources for those struggling. Advocating for patients and harm reduction practices will also decrease deaths from drug misuse. After identifying patients who are at risk for drug overdoses, you can promote prescription drug monitoring programs to aid them in their recovery. Promoting opioid agonist therapy will also help aid people in their recovery by reducing cravings for opioid drugs and preventing withdrawal. Opioid agonist therapy helps individuals establish stability in their lives and reduce the harms that occur as a consequence of their drug usage. You may also communicate with other professionals to aid in your patient's recovery.
Thank you so much for listening to our presentation. Please fill out this post-presentation survey. Once again, it's anonymous and you don't have to fill out any questions that you are uncomfortable with. All right, thank you.
Thank you so much.